were doubled. Each year of service in the force counted for as double upon retirement. And then the doctor was entitled to 1 year, 1 year leave for every 1 year of service. So it was very lucrative. But yet, they didn't. A lot of them. This was enough to encourage them to enlist, but only a few survived. Only a few survived. Okay, so that's encouraged the British colonialists to employ the Africans, the African doctors, the ones they could find. So the first Nigerian doctors, the first Western trained Nigerian doctors who graduated in 1859, Africanus Hudson Bell and William Davis actually served in the West African Frontier Force. They served in the West African Frontier Force, even when their medical school education was funded by the Church Missionary Society. So even though they were trained by the church, yet they served in the army. They served in the army. Okay, so the first Nigerian medical doctors, Africanus Houghton Bell and William Davis, served in the British, in the West African Frontier Force. Okay, so when the British finally fought and conquered the land, they declared sovereignty over Nigeria. They declared sovereignty over Nigeria. And because they declared sovereignty over Nigeria, the needs of Nigerians became their responsibility. The basic needs of Nigerians became their responsibility. And one of these basic needs is medical service. So they converted the military hospitals. Military hospitals served the soldiers and their families and some civil servants. And civil servants. So, but once they declared sovereignty over Nigeria, they converted their military hospitals into general hospitals, hospitals that not hospitals that are that treat the general public. Okay, so one of the first hospitals to be so converted was the former military hospital, Lagos, which became the Lagos Colonial Hospital. And this hospital was built in 1873. This hospital was built in 1873. So this makes it the first general hospital in Nigeria. The first general hospital, or we can say the first public hospital that is open to the general public. So Lagos Colonial Hospital, which was built in 1873. However, the first purpose-built hospital was the St. Margaret's Hospital, Calabar. St. Margaret's Hospital, Calabar, which was built in 1891. It was a joint venture between the Presbyterian Church and the colonial government. The St. Margaret's Hospital currently forms part of the University of Calabar Teaching Hospital. So the first purpose-built hospital in Nigeria, the first purpose-built general hospital in Nigeria was the St. Margaret's Hospital, Calabar. While the first general hospital was the Lagos Colonial Hospital, which was established in 1873. Okay, so the colonial government. So when the colonial government built these hospitals, when they built the hospital, they realized that these hospitals were actually a hit. Were heavily patronized by our forefathers, because the hospitals were able to treat a lot of the diseases that were difficult for the traditional medicine practitioners to treat. So the colonial government actually used the general hospital as a way to pacify our forefathers, and they convinced them that they came to bring better life. They came to bring better life. So general hospitals were quickly built all over Nigeria. All over Nigeria. In fact, any place the British conquered, they quickly established general hospitals. Okay. The British, they established general hospitals. They also established so-called European hospitals, which were not general because they treated only European patients and probably a few senior civil servants. But they were usually built in the GRAs, government residential areas. They were built in the government residential areas, and these government residential areas. Are not open. We are not open to everybody. The government residential areas were not open to everybody. In fact, the residential areas were a restricted zone. For example, children were not allowed to spend the night in the GRAs, government residential areas, because children were said to harbor large large levels of malaria parasites. And those white colonialists were particularly very, very afraid of malaria parasites. Okay, so the colonial government, they also built infectious disease hospitals. They built infectious disease hospitals. These infectious disease hospitals were specially established to treat those diseases that were capable of um, of causing epidemics. They were, yes, those diseases were capable of causing epidemics, like smallpox, like tuberculosis. Okay, so the colonial government built these infectious disease hospitals in almost all the towns. Unfortunately, these infectious disease hospitals have been converted into other uses. In most parts of Nigeria. The only one that is still functioning, as an infectious disease hospital, is the Yaba Infectious Disease Hospital, which was even used during the COVID-19 pandemic and was built in 1903. So, in other words, to recap, the colonial government, they built general hospitals. They built general hospitals because general hospitals were a sign that the colonial government brought better life, because the general hospitals were able to treat diseases that the traditional medicine practitioners couldn't treat. The colonialists, they also built um, European hospitals that were restricted to treating European patients, and then they built infectious disease hospitals, where they treated patients with infectious diseases, especially those that are capable of causing epidemic, like tuberculosis, smallpox. Okay, so they built all these hospitals. Not only, yes, so the colonial government, they built lots of hospitals. In fact, they built several hospitals, including up to the districts, up to the municipal headquarters, and they employed colonial medical officers. And these colonial medical officers, they didn't just, I think they were even overworked. Colonial medical officers were overworked, because they didn't just run the district hospitals, but they also treated the prison patients and also helped out the district commissioner in carrying out some administrative responsibilities. And not only that, they oversaw the rural dispensaries that were established. So the colonial government, they did well. So they didn't just establish um, hospitals at the district headquarters, at the townships, but they established rural dispensaries where lowly trained workers, manned, and those lowly trained workers were basically treating ulcers. We are basically treating ulcers and dispensing very few oral medications that were available in that period. If you look at these ulcers, don't think that they were caused by injuries. In fact, they were caused by infections. They were caused by infections. Group of infections called tropical ulcers. They just uh, explode and create massive holes in the limb of people. So these were the ulcers that these dispensary workers were treating. So so okay. So so those they are the rural dispensaries. They were just treating those tropical ulcers. They were treating tropical ulcers. So the colonialists, they also established mobile feed units, and these mobile feed units went from community to community. They went from community to community, immunizing people, especially during epidemics. So what happened was that, of course, they had their medical consumables loaded in a Land Rover Jeep. So they will move to a community, camp there in a public building, and then immunize people. Immunize people. Usually they will just show film. They will just show film, and to attract people. And as people came to watch the films, they will tell them about. They will do other medical health. They will give health talks and then give vaccination, and then also treated people. So they moved from place to place, and they were instrumental in tackling the epidemics of those epidemic diseases. Helping out, they helped out in controlling them through massive vaccination. However, the colonial government, they didn't employ they employ mostly men. They employed mostly men, and so they didn't provide maternity services. They didn't provide maternity services, especially because men of that period, they weren't comfortable allowing men to take delivery of their wives. So maternity services were not provided by the colonial government. Instead, church organizations had to fill that gap. And the most prominent, or one of the most prominent, was the Rural Midwifery Program. Rural Midwifery Program of the Church Missionary Society. This Rural Midwifery Program, what they did was they would go to a community, set up a maternity home, recruit young girls, train them, and then allow them to run the maternity services, to provide maternity services in those in the established maternity homes. I must say that I am a direct beneficiary of this, because my mom was one of those that were trained, and then yes, and we were trained, and at the time she was the only midwife in the whole of my clan. In fact, by the time she died, we estimated that she would have taken the delivery of over 20,000 babies. 20,000 babies. So because she was very, very active. In fact, at times helping up to 5 women give birth. Okay. So this rural midwifery program was established by the Church Missionary Society to fill the gap left by the colonial government, who provided other health services apart from maternity services, because they employed mostly men, and people were not, husbands were not too comfortable allowing men to take the delivery of their wives. So that was the reason why these church missionary medical missionaries came to fill the gap. Okay, let's just quickly discuss the prominent personality of early Nigerian medical services before we allow questions to be asked. Then the first doctors. Let's know the first doctors. The first doctors were two. Two are recognized as the first Western trained doctors in Nigeria. Two. They were Africanus Horton Bell and William Davis. In fact, we claim them as our first because of their Nigerian ancestry. Because technically they were Sierra Leoneans, because they were bred in Sierra Leone, educated there. Okay, they were educated there, and then they didn't even practice in Nigeria. But we claim them to be the first Western trained Nigerian doctors. Africanus Hudson Bale was of Igbo ancestry, while Williams Davis was of Yoruba ancestry. Okay, so however, the first Nigerian doctor to practice in Nigeria was Nathaniel King. Nathaniel King was the first Nigerian doctor to practice in Nigeria. However, he was a private practitioner, providing services mostly to the CMS missionaries, Church Missionary Society missionaries. Okay, once in a while, he also provided locum. He also served as locum doctor in the Colonial Hospital, Lagos. Okay, so the first Nigerian doctor to practice medicine in Nigeria was Nathaniel King, who practiced in Lagos, of course. Then, however, the first Nigerian doctors to be employed into this public service were Obadiah Johnson and John Randall. Obadiah Johnson and John Randall were the first Nigerian doctors to be employed into the colonial medical service. In fact, they were employed because of the 1888 Adeolu scandal. Adeolu scandal. In fact, Adeolu was a destitute. She was found sick in the market and then taken to the Lagos Colonial Hospital. She was treated, but she died. But so people of that period felt that she died because she was not given adequate treatment, and that she was not given adequate treatment because there were no black doctors providing service in the hospital. Okay, so that led to the employment of Obadiah Johnson and John Randall. Okay, so this created scandal. A destitute brought to a public hospital, treated, but they felt she wasn't treated, she wasn't given the right treatment. If we come back to our present time, can we hold government? Can we hold government to account for such? The answer is no. So if a colonial government can be embarrassed or blackmailed because a destitute wasn't given the right medical treatment, what happens now? What happens now that people that in public hospitals in Nigeria, people are not seen except they have the money to buy the card to see the doctor? Accident patients are not often treated except the good Samaritan that brought them to the hospital pays for the drugs or even for the card. So you cannot equate the government, the colonial government of that period, with our own indigenous government. They were as early as 1888. They were embarrassed. Colonial government was embarrassed for not treating, not that they didn't treat, not treating a destitute well. How much more now? How much more now? Eh? How much more now? More than 100 years after. More than 100 years after, people are still dying in government hospitals because of their inability to pay for services. We have not really done well as a nation. Okay, so we move on, but let's just remember the context in which the first Nigerian doctors were employed into the civil service, Obadiah Johnson and John Randall. Then this guy, we have met him before, but we have to also recognize him. He was one of the earliest Nigerian doctors. In fact, he graduated in 1887, one of the first. We know him. We know him for getting initiated into the Shopono court, and with that information, he was able to identify the modus operandi of those worshippers of Oshopono who were actively spreading the infection. Okay, but we also recognize him because he was able to combine traditional medicine with orthodox medicine, and he became a very successful doctor. And he did well. He did well because medicine, European Western medicine of that period, only had very few drugs. Very few drugs. In fact, some people think that just the only effective drugs they had was morphine and quinine. Okay, so Oguntola Sapara was able to expand the kind of drugs he gives to his patients. He was able to expand, and not only that, he had some formulations. One of the prominent of which is Bomoro. I'm sure that those of us that are older enough would have heard of Bomoro. Bomoro was, at least I saw Bomoro up to a few years ago, and Bomoro was usually often used to treat what they call teething, when a child is teething and having some symptoms. But I assume that this Bomoro contained quinine and morphine, so it would have been very, very effective in several situations during that period. Okay, so we know about, we should remember this guy, Oguntola Sapara was one of the first to combine orthodox medicine with herbal medicine, apart from helping out with the ban, bringing the evidence that led to the ban of the Shopono worshippers in Yoruba land. Okay, so I think we can take questions and comments before we move on. Do we? Questions and comments if there are questions we can take before we move on to the role, the contributions of the church in healthcare delivery in Nigeria. Hello, Yusuf Mohammed.
I got lost somewhere actually during the field medical field medical unit, something like that. You made mention, you made mention one lady died after receiving, like, after helping in deliverance of, is that 80 children or something like that? Please, that is
No. Okay, you really didn't get it. I was
Okay,
talking
I
about.
really don't get it.
I was talking about the rural midwifery
Okay.
program, and I said the colonial government, they didn't. They employed mostly men, and
Okay.
husbands were not comfortable allowing letting men
Okay.
help in the delivery of their wives. So
Okay.
that was how the church, church missionary society came
Okay.
with their rural midwifery program. And I said that I am a indirect beneficiary, because
Okay.
my mom was trained, was one of such young girls that were trained, and she became the midwife in my place. And I was just saying that before her death, we estimated that
Okay.
she must have taken the delivery of over 20,000 babies.
Okay.
Okay,
Yeah.
so that is that. Thank you very much.
Thank you very much.
Yes, I
Yeah,
can see that you are
Thank
still
you.
in Salah. You are Salah where?
Yes, I'm from Sokoto,
Hello.
sir. Yeah, Salah is going well, sir.
Okay.
Thank you very much. Yeah.
Yes. So yeah.
Thank you very
Akoy
much.
murumna. Akoy muruna.
Muna sosai, sir.
That okay.
Thank you.
Okay.
Thank you
Hello,
very much.
Ebere Fortune. Ebere, are you there? Okay.
Hello,
Yes.
hello, Prof. Good evening.
Yeah. Good evening, Abe.
Hello. Thank you for your lecture, Prof. I don't understand what you mean by 1 year leave in 1 year service. That is when the Nigerian doctors were employed to encourage them. They
Nigerian
were giving.
doctors, not Nigerian doctors. Those British
Okay.
doctors or British health workers. Eh?
Okay.
They were dying. In fact, they were dying. Some of them lasted less than 1 week. In fact,
Okay. Yes.
West Africa was a white man's grave. So,
Yes.
in order to encourage them to enroll, they
Okay.
offered them that incentive. They
Okay.
work for
So.
1 year, and then they'll go on leave for 1 year.
Okay, for 1 year. Okay. Okay. My second question is, please, what's the meaning of purpose hospital? The
Sorry?
first purpose hospital.
Yeah, no, I
The
said
first purpose.
Purpose built. That
What's the
is
meaning of that
that's
purpose
from the
built hospital?
beginning. From the beginning, it was
Mm.
conceived as a general hospital.
Okay. Okay.
When the foundation
Okay.
was laid, it was laid to be a general
A
hospital.
general hospital.
Unlike
Okay,
the
that's the
colonial
purpose.
hospital, unlike the colonial
Okay.
hospital in Lagos that was converted, was a military hospital and then converted to a general hospital.
Okay. Thank you, Prof.
Okay, thank you. In case John.
Okay, good evening, Prof. Thank you very much for your wonderful lecture.
Yeah.
One of my questions has been clarified. The second one I wanted to ask is, it seems like majority of the services seem to be tailored towards the medical services in terms of the doctors. For the nurses and other allied professions, then the nurses, is it the midwifery program that is like what was the health service doing? What I wanted to clarify that.
Yeah, they employed perhaps a British doctor, and then supplemented with locally trained staff, but they were mostly men. They were mostly men. Of course, they had to employ literate people, those that can understand English, and they weren't enough women then. Okay. Yes. So yeah, that was what the colonial government concentrated on. It was the church that started the rural midwifery program. Okay. Hello, Charity. Hello, Charity. Okay. No luck. Okay, so we'll just move on. We move on to, let's just look at, we have talked about what the medical services provided by the colonial government. We said, of course, they established general hospitals, they established their own European hospitals for their own purpose. And you will agree with me that the European hospitals were better equipped than the general hospitals. They also established infectious disease hospitals where those with infectious diseases were treated. And then they had the mobile feed units that moved from community to community, providing medical services, carrying out health education, and then vaccinating people. Okay, so let's look at the contribution of the church. The contribution of the church was significant, especially in southern Nigeria, because in the north, especially in the Emirates, in the Muslim north, the church missionary societies were not allowed to establish hospitals. Yes. In fact, it was the policy of the colonial government that they must seek the permission, express permission of the emirs before they can establish hospitals in the north. And I think it is believed that is the reason why there are less hospitals in northern Nigeria compared to southern Nigeria, because as at the time of Nigerian independence, more than 50% of inpatient beds were provided by church missionary societies. And the most prominent of them include the Roman Catholic Mission, the Church Missionary Society of the Church of England, Anglican Communion, the Church of Scotland, the Methodist Missionary Society, the Nigerian Baptist Mission, the Sudan Interior Mission, and the Sudan United Missions. These were the most prominent medical missionary societies that helped to establish hospitals in Nigeria during the colonial time. The Roman Catholics, they have not just one society, but several societies and others. And they are made up of men, women, clergy, lay persons, all working together to provide medical services. In fact, as at the time, the Roman Catholic Church built the highest number of hospitals in Nigeria, because as at the time of Nigerian independence, the 40% of inpatient beds were provided by Roman Catholic hospitals. And I think even at present, they still provide significant medical services, especially in the southeast. Then we have these church missionary societies. The church missionary societies, they also provided hospitals, health facilities, but their health facilities were mostly dispensaries, because they are missionaries. The missionaries of the Church Missionary Society of the Anglican Communion, they were trained. They were given some basic medical training. They were given some basic medical training and charged with not only evangelizing, setting up churches, but they were encouraged to set up dispensaries, so that they were able to take care of the body, both the body through their dispensaries, and of course the spirit through their administration. Okay, so and they established, in fact, some of the earliest dispensaries in Nigeria were established by the Church Missionary Society. I think the first was at Obosi, Enyono. I hope I got that. Enyono Hospital. It is currently is still in operation. I think it's now a specialist hospital. So, what's about the first to be established? Okay, then we have the Church of Scotland. Remember the St. Margaret's Hospital that was established in 1891 was a joint venture between the Presbyterian Church and the colonial government. Of course, Mary Selector that helped in stopping the killing of twins was a Roman Catholic. Was a Presbyterian. Was of the Presbyterian Church. And then the Methodist Church, they also provided medical services, especially along in Yoruba land and along the Calabar River. They built the Wesley Guild Hospital in Elisha, which is currently part of the Obafemi Awolowo University Teaching Hospital Complex. And they also ran leprosy settlements. One of the prominent of them this mission also provided hospitals Bowen Medical School, and they also built other hospitals in the Niger Delta, including the hospital in Jankrama and I think Elele. So those of us in River State should realize or should note that the Jankrama General Hospital and I think the Elele General Hospital were built by the Nigerian Baptist Mission. And these general hospitals provided medical services. In fact, the one at Jankrama, which Jankrama is located, is in the Onaras region. In fact, my grandfather, actually spoke of how they had to paddle canoe to Jankrama to access services at this the general hospital at Jankrama. Then we have to also recognize the Baptist Mission, because they were the first to introduce dental services into Nigeria. They were the first to introduce dental services into Nigeria. Then the next ones are the Sudan Interior Mission and the Sudan United Missions. They were active in the Middle Belt. They were active in the Middle Belt with I think one of their main objective was to convert the pagan communities in the Middle Belt, in the North Central Zone, to convert them to Christianity for the Crusaders, the Islamic Crusaders reached them. So, and they did that using medical services, using agriculture, and using education. Medical services, agriculture, and education. Agriculture and education. And they built hospitals, they ran dispensaries, and then they ran leprosy settlements. And some of the hospitals that they established are still serving very useful purposes. Birmingham Bingham Memorial Hospital, and Jos. It's in fact, it's currently a teaching hospital. And then we have the Evangel Hospital. Evangel Hospital Jos was the place. If you have read the story of Lassa, you would have met this Evangel Hospital because it was a nurse of that worked, an American nurse that worked there, that developed some, or one, I think one or two died. The other one was sent to the US, where the Lassa virus was first isolated, I think in 1969. So Evangel Hospital. So these Sudan Interior Mission and Sudan United Missions, they are interdenominational. They are interdenominational Christian medical missionary societies. They were interdenominational. So unlike the others, they were interdenominational, and this is the reason why the other churches, if you look at the churches in the south, in the north central, they are not like the traditional churches, because they were the descendants. They are the descendants of these missions, Sudan Interior Mission and Sudan United Missions. Churches like West Africa. Is it Ekwa, and then Kusin. They are all descendants of this Sudan United Mission and Sudan Interior Mission. And I must say, they bear the name Sudan, not because they were based in Sudan as a country, but because the country, the whole area from Sudan to the coast, were formerly called Sudan. So that was the reason why they were so named. They were so named. Okay. I will just quickly talk about the contributions of Muslim medical history in Nigeria. To set the templates, most of the medical services in southern Nigeria were provided by the church missionary societies. But in the north, these missionary societies were prevented from establishing these hospitals by the emirs out of fear that it may be a ploy to convert people to Christianity. Okay, so they didn't allow, especially as the colonial government made it mandatory that they must get the express permission of the emirs before they will be allowed to operate. So they didn't get any of such. So instead of that, because of that, the closest they got were at the fringes of the emirate. They are the fringes of the emirate, particularly in Zaria, and all those people. So, which means that in the Muslim north, during the colonial period, the government, they established hospitals. Employed colonial medical officers who provided hospitals but these hospitals were situated mostly in the urban centers. So there were very old hospitals, old general hospitals in Katsina, in Sokoto, all the major emirates, headquarters in Katsina, yes, in Kano. All the major emirates had general hospitals established. So, but in the rural areas, people had to rely on Islamic medicine. Unfortunately, the Islamic medicine didn't retrogress Islamic medicine retrogressed. So in the rural areas, they were mostly using what we can call traditional medicine, which is traditional medicine. Yes, mostly using they mostly use traditional medicine. Okay, then mostly use traditional medicine. So that is the situation with hospital services in the north. Okay, so I don't know if there are questions or comments on the history of medical services in Nigeria, starting with, okay, we have talked about that of the church, and then the next one is the ones that were provided in Muslim North. Do we have any question or comment? Any question or any comments on those? Any question? Any comment? Okay, so we have Yusuf. Yusuf.
Yes, sir, thank you very much for the presentation. So, my question is that during the Islamic medicine, contribution of Islamic medicine in the northern Nigeria, I was expecting like to include prayers part of the medicine. Yeah.
In fact,
like you say, oh, sir.
In fact, that is significant. In Muslim, the Sikh Muslim believes that it is only God that will heal him.
Yes, yes.
It is only God. So because of that, they are more pious. They are more pious. They seek the help of God with patience and prayers. They
Yes, yes.
the remembrance of God to obtain peace. They ask for forgiveness. They
Yes,
give
yes.
charity, zakat.
Yes, yes, yes,
And
of
then
course.
they read and listen to the Quran. And
Yes,
then at times they drink rubutumalam.
yes, of course, that's my expectations. Okay, thank you very much, Prof. Thank you very much.
Well done, Yusuf. Nagode. Hello, Nura. Hello, Nura.
Okay. Sir, good evening, sir.
Good evening.
Yes, sir. Thank you, sir. Well done for this presentation. As my question has already asked by the Yusuf Muhammad, sir. So I'm clear and satisfying. Thank you, sir.
Okay, thank you very much.
Hello.
Yeah, thank you, Nura. Thank you. So we can go to Charity. Hello, Charity.
Yes, Prof. Good evening, sir.
Good evening, ma.
Yes, sir. Sir, please, sir, I want to seek clarification. You talk about tropical ulcer. So I want to find out, is tropical ulcer the same thing as Bruley ulcer now? Because that is what we know.
Yeah, Broly is still there, but there were others like yours and
Okay,
others.
sir, Prof, you also talk about Yaba infectious disease of hospital that is still functioning till now. It's only that one that you mentioned. But I also know of Calabar IDH in Calabar that is still functioning. Or is that one not included?
No, I wasn't aware. So thank you very much, Charity, for reminding me. So I have to reverse the test and say and include Calabar.
All right, Prof.
Okay. So thank you very much, Charity. So we move progress. We are going to talk about the history of public health. The history of public health. Yeah, we have been talking about the history of medical services. Now we have to talk about the history of public health. Public health is not exactly the same as medical services. Medical services treat individual patients and are usually provided in health facilities, hospitals, health centers. But public health, we do public health to protect the entire population. So at times we have to most times walk in the community. We walk in the community. Okay, so we have also told you that the history of public health is actually the history of epidemic diseases. The history of public health is the history of epidemic diseases, because we told you that for endemic diseases like malaria that do not pose much threat to others, it is the patient that gets himself or herself treated. Is the patient that gets himself or herself treated. Okay, so but it is the epidemic disease that affects a lot of persons at the same time and kills more than expected at that time, that get people to panic, get people to begin to wonder whether they have been the gods are angry with them or so forth and so on. So usually they band together, members of the community will band together to control the epidemic, to save themselves. Okay? So in course of history, these epidemic diseases have been attributed to three reasons. The rot of the supernatural, bad air, and then foreign imports. Rot of the supernatural, bad air, and then foreign imports. When in the non-scientific past, in almost all traditional societies, they usually attribute disease outbreaks to the rot of the supernatural. Okay, that the gods have been are angry and therefore visiting the members of the community with pestilence. If you read the Bible, you will hear about a lot of pestilence. Okay, and then okay. So in our history, there are several of them. The Yorubas, when smallpox became a problem during the early colonial time, they deify smallpox, converted smallpox to a deity, worshipped it, to beg it to stop infecting and killing them. Okay, then there are other things things we can find in history. For example, the bubonic plague. Bubonic plague killed more than a quarter of the whole population of Europe within a 6-month period. People were dying. The whole communities were wiped off. It even invaded the most secured castle and killed them, and killed kings, queens, prince and princesses. The bubonic plague killed them. So they thought that it was because they allowed Muslims to occupy Jerusalem. So they launched the Crusades. Then they moved from Europe to the Middle East to go and reconquer, to go and take over Jerusalem. Unfortunately, that even increased the spread of the plague. Okay, then bad air. Bad air was also a common cause. Of epidemics. Also a common cause of epidemics. People believe that bad air, if you breathe in bad air, it can get into the body and cause sickness. Okay, so starting with the Romans, they believe that malaria was caused by the decomposition of marshes, foul decomposition of marshes. Okay, and then at later time in Europe, plague was said to be caused by miasma, bad smell. And then at that time, doctors went from door to door treating patients. So because because it was because it was believed to be due to bad air, the doctors had to get themselves protected. Yes, and that was the reason why they dressed like this. They dressed like this. They covered themselves from head to toe with glasses, goggles, and even this bed-like peak, where they even included fragrances to counter or to neutralize the bad air. Okay, so plague doctor. Then even the Romans they built hot toilets. They built good toilets to take away the bad smell from fecal matter, And then the Indians burnt insects. The Indians burnt insects to take away the bad smell that they believe was responsible for epidemics. Then the third one is foreign imports. This foreign import is still very tenable. It's still very tenable because even as early as late as the COVID-19 pandemic, um, uh, COVID-19 pandemic is said to be of foreign import. Started from Wuhan, China, and spread around the world. So this foreign import is a reason that is still tenable up to this time. But the first place the quarantine regulation was first implemented was at Ragosa, the modern day Dubrovnik, Croatia, uh, who introduced the quarantine legislation in 1377. In that regulation, in this quarantine regulation, they required any ship or anybody coming from a plague infected town, infested place, to spend at least 1 month outside the town before they will be let out. So, which means they were quarantined for a period of at least 1 month before they were allowed to. So, the first to implement this quarantine regulation was at Ragusa, the modern day Dubrovnik. Okay, then they succeeded. They when they implemented the quarantine regulation at the Dubrovnik, that's Regosa in the past, it was successful. So they tried to replicate it. But the people that went further to constitute a board of health, was first constituted at the northern Italian cities. The northern Italian cities, they constituted a board. These boards were tasked with the responsibility of determining the presence of plague, establishing quarantine, issuing health passes to people, arranging for the burial of plague victims, fumigating their residents, and then managing the isolation centers, which they call the lazaretos. Okay, so these health boards were publishing weekly mortality reports. They were publishing weekly mortality reports as a way of identifying the occurrence of plague. They weren't interpreting those records until this guy, John Grant, actually did a calculation, and he was able to calculate the mortality rate of a person, and he went on to develop the first life table. In fact, we are going to meet this guy, John Grant, in your next course. Because yes, in your next course, you are going to meet him. Okay, So then we move to the industrial age. In the industrial age, once machines were developed, first in Britain, people moved from the rural areas to the urban centers. And whenever people move from rural areas to the urban center, they usually don't have enough money. They usually don't have enough money to. They usually do have enough money to. They usually do not have enough money to rent decent accommodation. So usually they will find accommodation in slums. In slums. Slums do not have toilet facilities. They don't have a refuse facility for. They don't enjoy refuse collection services. And then of course they don't have toilets. So these slums are usually very dirty, and they were indeed the slums in 19th century England were very dirty, such that they became the epicenter of epidemics of diarrhea, typhoid, plague, and all the other things. Okay, so they were becoming a threat to the health of everybody in Great Britain, and that encouraged them to establish the War Commission. Sorry, the Poor Law Commission. Poor Law Commission to find ways of improving conditions in the slums, to find ways of improving conditions in the slums. They find way of improving conditions in the slums. Okay, but before that, I have to introduce you to this guy, John Snow. John Snow was a general practitioner. He was also involved in early anesthesia, such that he was said to be one of the anesthesia of Queen Victoria. So, but during the epidemics, the incessant epidemics of cholera and the rest happening in those slums, they were said to be due to miasma. But John Snow suspected that it may not be miasma. It may not be miasma, because if it were to be miasma, it could have affected the respiratory tract. But instead, he noticed that the cholera affected the GIT, and that was why he suspected that the cholera epidemic will maybe from what people drink or from what people drank, and he suspected that it may be from water. It may be from water. It may be from water. And when he removed the handle of the pump located at the Broad Street in London, a London suburb, the epidemic stopped. Apparently, the water from feeding, the water from the Broad Street pump was actually collected from downhill London, which means that downhill London means that most of the sewage of London had to. They were drinking sewage. They were drinking sewage because the water was flowing, and usually if you pull uphill, the water will carry it downhill, and unfortunately, that was the place where the Broad Street pump water was collected. So we have to know about this John Snow, and I'm sure that you are going to know more about John Snow in the next course. Because a little bit of history of epidemiology will be taught. Okay, so back to the laboring masses. back to the labor law. A poor law commission was established in Britain to find ways of improving the condition of these poor people. And this man, Edwin Chadwick was a lawyer. He was appointed as the secretary of this poor law commission, and in course of his investigation, he was able to establish a clear link between unsanitary condition, overcrowding, and the outbreak of these diseases. And therefore he recommended for the passage of the Public Health Act. And this Public Health Act, this Public Health Act was enacted in 1848. This Public Health Act was enacted in 1848 and charged with the Act recommended the creation or prescribed the creation of local health boards, which were charged with the responsibility of providing clean water, sewage disposal, control of offensive trade, ensuring the quality of good food, paving the streets, and removal of garbage. In fact, they were charged with the responsibility of cleaning up the environment. They were charged with the responsibility of cleaning up the environment. In fact, the Public Health Act also decreed the employment of a medical officer of health. And this medical officer of health was charged with the responsibility of ensuring the clean environment, especially the slums, ensuring the slums were cleaned. Okay, so when Edwin Chadwick was able to establish that link between dirty environment and the outbreak of these diseases, it got the buy-in. That got the buy-in of the middle and upper class ladies. It got the buy-in of the middle and upper class ladies who lived a pampered but boring life, because they had everything. They had servants that did everything for them. So it provided them the opportunity to move out and get involved in sanitizing the environment, such that they became the first members of the public health associations. They became the first members of public health association, because what was needed to practice public health was just this sense of smell. So if you have a keen sense of smell, you can practice public health. So these ladies were one of the first practitioners of public health, and they did a good job, because the outbreak of these diseases, the outbreaks of cholera came down. Outbreaks of cholera and all those diseases came down. Okay, and then the germ theory came and spoiled everything. The germ theory came and spoiled everything. So with the acceptance of the germ theory, it was now known that it wasn't the bad smell that was causing the epidemics, but was actually the microorganisms. It wasn't the bad smell, but the microorganisms. So public health moved from environmental sanitation to bacteriology, collecting samples from the environment and then testing them in the public health laboratories that were established to ascertain the presence of these microorganisms. Okay, so the new public health, what they did, so the new public health moved from a profession, all commerce profession, with these upper class ladies as prominent practitioners, to a more scientific profession that required knowledge of bacteriology. So public health became a practice that involved the collection of samples, environmental samples for food, for water supply, sewage, food, and they were taken to the laboratories where they were looked at, and in the process they were even able to establish regular values to determine whether something is unsanitary or not. For example, water. Water is said to be safe if, in fact, what they were able to establish that the presence of E. coli is indicative of fecal contamination of the water. But they also believe that if the water contains less than 10 E. coli per deciliter, that water is not likely to cause diarrhea. That was what they were able to establish. Then they were given a further boost with the discovery of vaccines, by Louis Pasteur and others. So vaccine gave them a very potent weapon weapon that do not involve no much effort. And whenever there was an epidemic, they just went there and immunized everybody. And they used compulsory vaccination. Nobody was exempted. And even in colonial Nigeria, when they came into Nigeria, they also used that tactics, because it was reported that they even mounted roadblocks. And anybody passing had to show his or her vaccination card before they were allowed. And those that weren't vaccinated were immediately vaccinated before they were allowed to continue with their journey. So compulsory vaccination, they used it, and compulsory vaccination was able to couple with environmental sanitation, because cholera and others still required environmental sanitation for them to be for the outbreak to be subdued. So, but this led to people believing that almost all diseases are caused by germs, are caused by these microorganisms, until this lady, Alice Hamilton, found that workers in the canning and glass polishing industries were dying, and she was able to find that they were dying not as a result of germ, but as a result of poisoning through the use of white lead. And not previously, even James Lind was able to find out that scurvy, which was very, very common amongst the British sailors, is caused by vitamin C deficiency and not germ. And then possibly Port was able to link the scrotal cancers that was common among the chimney sweepers in London, to exposure to soot. Again, proving that some diseases are caused by factors that are not germs. Okay, so even when they did, with all the successes they recorded, they also noticed that the success were not uniform. Were not uniform in the community. The higher successes were recorded amongst those of higher socioeconomic class, and that brought in it became obvious that the social conditions of people are very, very important in the prevention of diseases and even the recovery from diseases. Even during the COVID-19, it was noticed that the mortality rate of COVID was highest amongst the Blacks and the Hispanic Americans compared to white Americans. So social conditions also play a very active role in the prevention and control of diseases. And that is where social medicine comes in. And social medicine is a way of ensuring, helping with the social economic conditions of people, especially as even WHO recognizes that poverty is a disease. So in public health, we don't just treat, we not only treat diseases, but we also treat social conditions, social ailments like poverty, Then the control of the epidemic diseases made people to live longer. They made people to live longer, and as people live, because of the longer life, because of longer life, the epidemic of non-communicable diseases became more common. Epidemics of non-communicable diseases became more common. So non-communicable diseases are actually very common amongst older persons. So as a population gets older, the prevalence of these non-communicable diseases will increase, as is currently happening in Nigeria. Once you control the epidemic diseases, the infectious diseases, people will live longer. And as people live longer, more and more of them will come down with the non-communicable diseases like diabetes and hypertension. So these non-communicable diseases, they don't kill as fast as the communicable diseases. So people live with them for a long period. And at times, these communicable diseases, they cause complications like blindness, like amputation. And that means that the non-communicable diseases will have to be treated in a different way. And part of the treatment will be to empower the patients, because the patient has the disease all the time. Non-communicable diseases are treatable, but they are not curable. So you cannot effectively treat these patients in hospitals. So what people do, or what public health is doing, is to train people, is to teach the patients what to do, how to do them, and when to do them, so that they can manage themselves. For example, in diabetes, more than 95% of the treatment required by a diabetic patient should be provided by the diabetic patient. So it means that the best way to treat a diabetic patient is not for him to be treated by the best doctor, but for him to be trained on the self-management of his condition. So the presence of non-communicable diseases encourage public health departments to introduce health education units whose responsibilities include to teach patients on what to do, how to manage their non-communicable diseases. Okay, we talked about the social conditions, and the social conditions led to the rise of social medicine. And indeed, in Europe, it was found that the Europeans lived longer, not because they had better medical services, but because they had better social conditions. Their feeding improved, their hygiene improved. With the improvement in water, in feeding and hygiene, Europeans lived longer, and they lived longer even before the major medical interventions like the discovery antibiotics. Okay, so it has been proven that if you solve the social problems of the people, probably their poverty, make them to eat better food, and then have better hygiene, they are more likely to live a longer life. They're more likely to live a longer life. Okay. I don't know if there is any question, any comment now, today. Any question, any comment? Okay. If there is none, we are going to end here so that our Muslim brothers can continue with their celebrations. So tomorrow we'll start with the history of the International Health Organizations. Then we'll go to history of medical services in Nigeria, and then we'll say something about. We'll go into the ethics and say one or two things about the ethics before we'll round up. Hello, Kainde. Hello, Kainde.
Good evening, Prof.
Good evening.
Well done, sir, and thank you for taking your time to tutor us and lecture us through this. My comment is this, not really a question, sir, about the longevity of the Europeans and everything. You made a statement that it wasn't really due to them having a better healthcare services, but because of their social standing.
Improvement in their social conditions.
Yeah, social condition. But sir, we cannot still divulge the good healthcare services to their longevity. Vis-a-vis, they have to endure and survive the under 5 states that we are still grappling with the high mortality here in Africa, in Nigeria, before all those things, right from the antenatal clinic, reduction of the maternal mortality, infant mortality, under 5 mortality. These are the indices where good healthcare services really come to play, even before the social standings or social level of the individual, which are rightly provided by the state. Yes, sir.
I want to ask you,
yes, sir.
Have you heard of what they call the child survival strategies?
Yes, Prof.
You know about the child survival strategies?
Yes, Prof.
How many of them are medical? Yeah, you see, that answers it, eh?
But yes, I agree with you, Prof. 100%.
No. Yeah, the thing there is this, advanced medical services are able to no, they are effective, but they save one person at a time.
Yes.
Yeah, they save one person at a time. During the COVID-19, a lot of the people that died were people with lower immunity.
Yes.
And that
with comorbidities.
Yes. Mm-hmm. Okay. So, and immunity now can be, that's why they say people can be eating some food. Generally.
Yes.
Yes.
Yes,
but perhaps you have to also check out this guy, Thomas McKeown. He wrote a book.
Okay.
He was a public health scientist, but also a healthcare critic. He wrote a book called The Medical Nemesis. And he was able to show that the decreased mortality from infectious diseases that occurred in Western Europe were more due to better nutrition and hygiene, and less due to because the effective drugs. So antibiotics were discovered in the late 1940s.
Yes,
penicillin. But this decrease in mortality actually started in the 19th century, late 19th century, when they had good when they introduced the sewerage system in
England.
Yes. In fact, at the end of last century, the readers of the British Medical Journal voted water and sanitation as the greatest medical invention, both anesthesia and antibiotics. Just to tell you, because they were having cholera epidemics almost on a yearly basis and was killing until they stopped. And even parliaments, they couldn't sit because of the smell that was coming out from the River Thames, because they were dumping sewage there. So people ran because of the smell, and then the outbreaks were incessant. Those living in those slums were seen as stigmatized. They are stigmatized because they were said to be responsible for the outbreaks. So, but not to say that medical services are not. Yeah.
All right. Yes. Thank you, Prof. Thank you, Prof.
Well done. Hello, John. Hello, Prof.
Hello, Prof.
Yeah.
Okay. Thank you once more for the wonderful way you were able to communicate the coursework today. I'm really, really grateful. I wanted to join my voice in this discussion. I have a comment and a question. I wanted to join my voice in this discussion about the social aspect of many of these diseases. I understand that, of course, good health care system is important, but come on, if you look at many of the communicable diseases, they have social factors today. Take, for example, malaria. Malaria is by mosquitoes. Mosquitoes, you see them in environment that are kept untidily, where there are stagnant waters and all that. And many of the time, you see that it is where people that are not so well to do, that have more of this stagnant water around them. They don't do much to be able to get rid of. They don't have very good drainage systems. All those places inside there, because of that, they will come up with more of these diseases. Even when you're talking about the under 5 mortality and morbidity rates, many of these people that are in the rural areas, they don't have access to good amenities. They don't have access to all the wonderful.
They don't have a lot of etc. Okay, so
yes.
So thank you very much, John. Or you want to add another one?
Yes, and my question is about social medicine. I don't know, is there a way social medicine is being like the physical implication of social medicine in our environment now?
How is being practiced?
Yes, exactly. In our direct.
Yes, it's not practiced with medicine. That's with drugs. But there are some principles. Public health now is what government is a government responsibility, and what underpins public health is what they call equity and social justice. Equity means that you treat unequal equal. You don't you give people, you allocate resources to individuals based on their needs. And then I'm sure that you must have heard of what they call the health for all. Health for all is actually it was a target, and the target was to ensure that everybody has a state of health, attains a state of health that guarantees financial and social independence, economic and social independence, which means that even if you are blind, they have to find a way to ensure that you are able to earn a livelihood so that you don't go begging. And you should be able to social. You should be able to interact with your environment. And they actually do something about it. So they actually do something about it. So in public health, equity and social justice, which we are going to learn more of in the next lectures. Okay, yes. And the other one is social justice. Social justice, we all live in a society and we should help ourselves. The rich should help the poor, and the poor should probably pray for the rich. In fact, that's why I like, in Muslim societies, they have charity. The charity is institutionalized. Society is institutionalized, and people are taxed based on their the poor man knows that the rich man who is his neighbor, if he gets richer, it means that he's able to, his tithe or his zakat will be higher. And if his zakat is higher, he will benefit. Okay? Imagine the tax that someone like Dangote will be paying. Imagine that tax. Imagine what it can do to a local government. We are not talking about not to talk of a community. So that is how it is. So if a citizen fulfills his role, the government, it becomes the responsibility of government to also take care of the person. And the other thing too is that at times social public health programs, they also pay money. If you have heard of what they call the conditional cash transfer. They did it during the Jonathan time. I think they also did it during the Buhari presidency. They actually paid money to families, poor families, on the condition that they will send their children to school, and then they will bring their children to the health center for immunization. So if they show the evidence, they are giving the money. And then public health is also intersectoral. They also will work with those in the Ministry of Agriculture to ensure that more food is cultivated, and then ensure food security. Yeah, so some of those things. Okay, I hope yes, I've answered that. Ezemoye.
Yes, Prof. Good evening, sir.
Yes, good day.
Okay, yes. It's not actually a question. In learning, the first thing is to also learn how to learn. And my brain has processed a lot of information you given from the first lectures last week to this one. So not to preempt you or the system per se, but I was looking at a situation where we could at least have a direction in terms of, how we're expected to go about some of these concepts. Not like example questions per se, but if you could give us something at the end of every lecture so that we can have an idea, of how to put all these information together in something that would make sense during the exam period, sir. Thank you.
We will do that. We will do that. Perhaps. Okay. We will send some MCQs for you to just look at. Yes, the exams will actually be MCQs.
Okay, sir.
Yes, sir.
All right. Thank you.
Okay.
Sir.
Hello, Princess.
Yes, good evening, sir.
Good evening.
Okay, sir, when you started the lecture, you talked about the first two Nigerian doctors that treated. And you asked a very important question that I've been trying to answer, although I can't answer. So I said, let me throw it back at you. You said, you asked, the question is, how do we, are we able to hold the healthcare service that they provide? I remember that in the somewhere in the law, it is stated that we can hold them accountable, that they are supposed to provide basic infrastructure for the citizen, but we cannot sue them if
it's
they don't,
not,
they don't
yes,
do that.
yes, it's said to be non-justiciable. You cannot
So how
sue.
do we hold them accountable, sir?
Okay, that is a problem. They are, because they know that it will have been a problem. But some people, perhaps we should be insisting on a minimum welfare package. We are not interested. In fact, if we decide that every government should be able to provide this, and that, it is only when they have finished providing them that they can move to other things. Because a lot of those things, a lot of the things are not, a lot of what we need are not picture perfect. They are not things that they will want to just put in, but they are necessary. If you build a school without desk, school chairs is completely useless now. It's completely useless. In fact, I don't know. I think we have really retrogressed. I am not too old, but when I was in primary school, they used to we had school desks. In fact, there is one. I think I still remember. I think it's new. That is Nigerian Engineering Works. Was actually established by the Rivers State government. I think partly owned by the Rivers State government. But I know they were charged with the responsibility of providing school desk to every school in Rivers State. Every school in Rivers State is so that even I went to school in my hometown, and we had them. So we don't need a very dark man and the other person to bring that shame out. So we should have the minimum package. It is only when they have provided the minimum package that they can now go and build that flyovers and all those things that they want to showcase. So, madam, that is the thing.
Thank you, sir. Thank you, sir.
Hello, Saprobi. Hello, Saprobi.
Yes, thank you very much, Prof, for the lecture. Yeah, really enlightening. Thank you very much. I really appreciate it. I wanted to ask, do we have, like in the e-library, can we find reference materials for all of these topics? Because they are very, very interesting, and someone may want to dig deeper.
I think we are working on that so that you will have full access to the e-library. Okay.
Okay, sir.
Yes.
Thank you.
Yeah, Chere. I think Chere will be the one. Will be the last person today. Hello, Chere.
Okay. Good evening, Prof. Thanks so much for the presentation, for this lecture. Okay, my question is: when you were taking the slides on non-communicable disease, you mentioned something about WHO declaring poverty as a disease. So, what year was it? Was it declared as a public health of international concern?
No, not of international concern. Anyway, that is what they call the International Classification of Diseases and Injuries, ICDs. In fact, so if you just look at so all the diseases are usually defined so that what you consider as disease in Nigeria If you consider something as malaria in Nigeria is malaria everywhere because it has been precisely defined. Okay, so that's that definition. The definition of all the diseases and ailments are contained in that ICD, International Classification of Diseases and Injuries and Disabilities. You can Google them. You can Google that. I'm sure that you may find that. So now, no particular year. But remember when we talked about okay, probably is the next one when we talk about the international organization. When WHO was established in 1948, it defined health as a state of complete physical, social, and mental well-being. That definition extended the concept of health beyond physical well-being, beyond diseases, to include social well-being. Social well-being. We know that in Nigeria, if you are poor, you are socially handicapped. You are socially handicapped. Let me just put it that way. Thank you very much, Chinyere. Thank you. And thank you very much for showing up in good numbers in spite of the public holiday. Thank you very much. So tomorrow we'll have another section. So have the best of the rest of the day. Braka di Sala.
Thank you, Prof.
Thank you, Prof.
Thank you very
Thank you,
much.
Prof. Thank you, sir.
Thank you, Prof.
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 Have a good night rest, everybody.
Thank you, Prof.